This is Sarnia Lambton Daily for Tuesday, April 14th. Good evening, I'm Terry Doyle. There has been another death in Sarnia Lambton as a result of COVID-19. The 11th death was announced earlier today by Blue Water Health. Details about that patient were not available as we went to air tonight. Overall, the number of positive cases in Sarnia Lambton increased by 1 overnight to 119, and 1 additional person considered recovered. From the last update, 11 tests have been administered, with 10 of them coming back negative. With the increase in the number of cases slowing down, have we hit a peak or flattening the curve? Medical Officer of Health Dr. Sadit Ranaday is not ready to make that declaration.
I would say we lagged a little bit from the center on this. You can look at this outbreak as sort of provincial, and you can look at this outbreak as sort of local. And if you think about it in a local way, I think our outbreak has lagged a little bit on timing. One of the epidemiologists from Toronto saying, we think we're right at the peak, or right at the beginning of the peak. I would say for us that we're about a week or so behind that. So I think we still see some increase in cases over time before we start to see that rate drop dramatically. So that's kind of where I'm holding us at, is that I feel like we're just a little bit late to say that it's a peak yet, but probably by the end of the week when we do a retrospective, we might be able to have more information on that. I think there's lots of speculation about the idea that we're not hitting those peaks because actions were taken in a timely way in terms of closures of settings where folks gather and in terms of implementing physical distancing. So to say that that's exactly the reason will take some time, but I think there's a lot of speculation that maybe what we have been doing has been working. I'm cautiously optimistic that that's the case, but I think it's not definitively established. I think we're still, to my mind, we're still in that hold your breath moment of, we're ready for a surge. We hope it doesn't happen because the things work, but we're still waiting to make sure that it hasn't. And so far, our local data and provincial data shows that ICUs are not overwhelmed in general, that the hospitals continue to have capacity, and that, so it's a nice bit of information to support the idea that maybe what we've been doing has been working. It's still too early to confirm, but it's encouraging.
While the Premier has been calling for more testing to be done, there has been an increase in tests conducted locally. New rules on who gets tested has led to that increase.
There have been new testing guidelines issued by the province that just expand the scope of testing and those who would be eligible, especially with respect to residents and staff in long-term care homes and other settings like that, as well as some other priority groups for testing. I would say that we had already kind of been operating with those priority groups already. It was just a matter of not having enough tests, and I think so first there was a lab backlog, and then there was a test backlog, and both of those are starting to clear up, and so we are getting increasing supplies, and it's not just us necessarily, but also, for example, the hospital and the assessment center, and everyone sort of has their own ways of ordering, and I believe that's there's some efforts to streamline that as well.
In Sarnia, residents have been encouraged to report concerns about people not following guidelines on physical distancing and essential services. To date, numerous complaints have been received. A total of 417 complaints have come in, mostly by email. This includes almost 50 emailed complaints coming in over the long weekend. Topics include lack of social distancing on private property, non-essential businesses operating, and people using park spaces and trails throughout the city. Let's go to Sarnia City Hall now and check in with Mayor Mike Bradley. And Mike, we're done the long weekend, of course, back into, I was going to say our normal routine, but it's certainly a different routine these days. What did you sort of see and hear over the weekend in terms of how the city of Sarnia and the residents did in terms of following the rules, physical distancing, and avoiding the Easter gatherings?
Well, it seemed to go fairly well. There were some groups warned that they were larger groups than they should be, following the provincial guidelines. I think the weather helped a lot because it wasn't as nice to be out there and do things. But there were people I noticed on the waterfront that were doing the right things and distancing. We did have some concerns, people saying there's too many people over at this house, that they shouldn't be there, and they should be, it can't be just a family gathering. But I'm not aware of any major incidents. I think the challenge for all of us is going to be when it gets warmer and people are getting restless. And when that happens, it's going to be there as a difficult time to try to give people the right to do what they need to do, but at the same time protect others. I mean, I think, Terry, the good news today in the last couple of days, we appear to have flatlined somewhat on the number of new cases. There was only one overnight and just a couple the other day. I don't want to get too over optimistic until we see a pattern develop, but it is a good sign that the isolation, the self-distancing is working, and you're seeing that across the province. So that's all positive.
You've mentioned, of course, some concerns coming in. The line was set up really right from the start of this, the 18774 Sarnia number for people, questions, information, but also expressing concerns. I've got to think that has become a success to at least also take the pressure off some of the other phone numbers that are out there that I'm not even going to mention that were maybe receiving some of those complaints when they should not have.
Well, I know it helped that it did take pressure off, and I will mention it, 911. Mm-hmm. We didn't see a great drop in the calls and emails that we got in the mayor's office, but it's all sort of one and the same pool. And people should keep in mind that in normal circumstances, bylaw is there to go out and enforce complaints from the public. The context of this is much different, obviously, because of the health crisis. So it seems to have worked. Over 400 inquiries by emails, phone, mainly email. And, some were just neighbors that didn't get along with neighbors and had a complaint. Most were looking for information because it is very confusing for the public. I mean, it's confusing for me as the mayor. We have certain things we do. We don't control some of the essential lists like the province does. The federal government has their role. So I can understand confusion. I'd rather people take the time to ask us, and then we get back to them and say, no, this is what the law is, this is what the guidelines are. So that was a positive experience, and I did talk from a distance with one of the employees today that was part of it, and they're finding the same thing. They're helping people in a time of distress.
And I guess one thing you've said from day one, communication. People need that communication, that if they get that answer, then at least maybe either alleviates the fears or they know the rules and know people. I'm sure there are people out there that want to follow the proper rules as long as they know them.
Yes, and that's the tone of some of the emails that I get is people just, can you tell us? I need to know. For example, there's issues about couples going to supermarkets together. I had a case the other day. Well, one person's individual and the other partner has to go with them. That's legitimate. But we do encourage, for example, people not to go as couples. One stay in the store, one go in and do the shopping. So those issues come up, and I again prefer people ask us and ask the question so we can get back to them with an answer. There are some enforcement issues. They get sent off to the bylaw or to the police, but they're pretty well a minority. So I'm pleased with the response. I know it had that cute little title of the snitch line. It has some aspect, just like Crime Stoppers does to it, about people calling in on concerns, but most of it is basically information and sharing knowledge with the public.
Have you heard as well that in a lot of cases with bylaw enforcement, that once someone understands what they're dealing with or what the rules are, they say, okay, I will comply, versus that sort of that odd person that might want to stand their ground a little more?
Yeah, that's the common theme. And now and then, as you will in any circumstance with bylaw enforcement, you'll get people that are difficult. And I admire the bylaw people because it's a very difficult job at the best of times. It's not, in most cases, a positive thing you're dealing with. But no, people, once they're told, look, you can't do this. And again, it's that misunderstanding. For example, the issue of parks. People can still walk through parks, but they can't use the playground equipment. They can't gather in groups, in the pavilions and things like that. But some people believe they can't go there at all. That's not the case. So it is important they go up and they try to educate first. You have to push hard for anyone to be put in a position where they're going to say to them, look, we're going to have to charge you.
What is the latest? What can you tell us about the situation with the boat ramp?
Well, that's an issue that's been debated for 4 or 5 weeks. There will be an announcement in the next 24 hours about the boat ramp. I would suggest to you, after considerable debate, that it's heading to closure. A final decision will be made by the primary control group, but we're there now. One of the big factors that kicked in is that Michigan actually banned all recreational boating. Just a day or two, the governor reversed herself and came up with that decision. So that's huge because Michigan's got the most boats of any state in the United States. So it tells you how seriously they're taking this crisis. I don't know if Ontario is going to follow suit, but we felt, looking at all the other places, we looked at Owen Sound and Port Colborne and all these other places that had boat ramps, and they tried to work with the public, but what was happening over and over again was people who were not related to each other were gathering in groups that were way beyond the numbers that are under the guidelines in Ontario. So it's a common sense decision. Will it be popular? I doubt it with the people that use it. But the reality is our greater job is to protect the public and protect the public from people integrating with each other that then could turn around and infect other people.
Is this the challenge where when you talk about enforcement, it's sometimes weeding out the 10% that don't want to follow, where because we're dealing with a public health concern, sometimes it is the actions of the minority that causes an action like this, such as closing the boat ramp?
Well, I use the 80-20 rule. That's what applies to most of life, right? 80% of the people will cooperate, whether it's speeding or using cell phones in their cars, and now with these new rules, and you got the 20% you've got to deal with. And sometimes it is ignorance, sometimes it's just defiance, and you see now and then across the country and in the United States, people popping up saying this is all nonsense, it's ridiculous, I'm going to defy it. That's their right, but they also have, we have a responsibility as a government to make sure that people aren't hurting other people. This is different. This is different because anyone can be that smoking gun that could infect someone with this disease. So, I think the community's done very well in trying to deal with the overall issues. And there is sacrifice. I use that word in the sense that, we really haven't sacrificed. And so you can't burn a fire in your backyard for a month. Is that sacrifice? In my view, not. Use of the boat ramp in a time of crisis, is that sacrifice? It's an inconvenience. Sacrifice, I don't view it in that way. And I look, it sounds very optimistic and positive, but if you think about it, in this crisis, we have clean water, we have food available, plenty of food available, and we have hydro. Those are the ingredients that can really inconvenience and make people sacrifice. We have those common agreements, and yes, it is difficult to be isolated for weeks at a time. But if we could get through the next few weeks and show that we've decreased the virus significantly, then we can get to that better place when we can start to gradually reopen businesses and the province of Ontario and Canada.
Let's shift gears quickly here. You, of course, you hear from various people with the emails that you receive, and I'm sure just when Air Mustang does those quick trips, I've got to think you still get to see some really positive experiences, either those little parades driving by for anniversaries or birthdays, or just some of those little things that I'm sure have gone a long way for people.
Well, Terry, those things are important, and I haven't been driving very much at all. I did a 60th wedding anniversary drive-by the other day, and I've got a couple other events coming up. I very basically have not left. It's home to City Hall to home and back, and I need the car in case there's another type of emergency out there where we need to be in communication or be at the police station, social distancing. But those small little events are really special, because they bring some humanity to what we're dealing with. And for the people that, we're going to have the 90th birthday party or the 60th wedding anniversary party, it at least gives them a memory that offsets what they're living with right now. So that's the positive part of this.
And I'm sure that's the thing, that at the end of the day, everyone still has to look out for each other. And I'm sure you've heard some really good stories as well of just people looking out, especially for the older population, where it's even so much more important for them to avoid the grocery store, avoid even those essential moves.
I hear a lot of those stories and people share them. And I think that's really positive, because we need to build on that, right? I always worry, though, as the mayor, about the people that don't have some support around them. I live in an apartment building where there's a lot of seniors, and you do wonder about some people, and you reach out to them, with a distance, but there's got to be people out there that aren't being taken care of. I've also, on the other side, I've been pressing very hard with the county, who's responsible for the homeless population, in the sense that that's where the government's giving the money, that's where they work with the Good Shepherd, River City, and the other groups to make sure that those who are totally voiceless are taken care of during this crisis. And I can say, to their credit, that there are backup facilities in place, and that there are plans that anyone who is homeless becomes infected, that they'll be taken care of in a different location. So that's all good stuff as we reach out and embrace each other. And that's what this is about. Through this time period, is to embrace each other and to give hope. And my message at the end of every email to everyone that emails me is very, very simple. It says, stay safe, stay home, and stay strong.
And we'll wrap it up right there. Mayor Mike Bradley, appreciate the update.
Thank you.
There's Mayor Mike Bradley joining us from his office at City Hall. Stay tuned, more to come on Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily here on your TV. Well, throughout this pandemic, many people have been stepping up, helping out many people in the community, including in the healthcare sector. We have an interesting story to bring you now. Let's bring in Jared Waller, who owns Radiant 3D Printing in Sarnia. And Jared, first of all, 3D printing, how did you get involved in that?
Well, back in 2018, I applied for the Sarnia, the Economic Partnership Program. The Summer Company Program. And I did that for the summer of 2018. And then from there, I kept my business going through the end of high school, and then even kept it going into my first year of university up in Ottawa.
So obviously, certainly an interesting project indeed. But now, using these skills and using the resources you have, you're making some equipment in terms of protective equipment for the hospital. How did this come about?
Well, shortly after I was sent home from university because of the pandemic, I was watching YouTube and I saw my printer manufacturer posted a video about manufacturing the face shields, and I thought that's something I could feasibly do on my own and produce for our community.
Sounds pretty interesting. What's the process in terms of the time to even make one of these?
Well, so I can print 8 at a time on all my printers I have right now, and that takes anywhere from 14 hours to 21 hours to print, depending on the printer I'm using. And after that comes off, so they come off in stacks of 4 like this. So that's four face shields right there, and then I break them apart like that, and they come into 4 pieces. And then from there, I have Peter at All Seasons Trophies is helping me laser cut the clear face shield parts on donated plastics from L&K Industries in Scarborough here. So we laser cut the clear shields off. We then take the band, we put an elastic on the back of it, and then simply snap the shield cover on. And then that's one completed unit right there to go to the hospital.
Very cool. Was there a little bit of, I don't want to say trial and error, but did you have to experiment a little bit? Or because, as you said, the drawings and the designs were there from the 3D printing, the manufacturer of the printer, once you got started, it's like, okay, this comes together. Was the challenge getting the face shield part?
I think there's many challenges on the way. Mostly, so the initial, I guess the first thing we had to do is make sure that it was comfortable for the healthcare workers, make sure it met their needs. So we had to actually extend the face shield by, I think, 3/4 of an inch on each side. And then it was getting the materials. So right now I'm waiting on some waistband material for a back strap instead of an elastic band. And then it was getting the plastic as well, because all the plastic that I've been trying to buy has been sold out. So as of till today, actually, I've been using plastic from Manley's Basics, which was just a laminate sheet. But now, thanks to L&K Industries, I was able to secure some proper plastic to make these face shields with.
And I understand now it is a case where, how often are you able to deliver some of these to the hospital?
I'm doing daily shipments. I actually got a new printer in today, thanks to the GoFundMe that my aunt started for me. I have a new printer coming in today that can do 16 at a time, which will put my total at my house here to 40 a day.
Wow, you know what? That sounds like you've got quite the busy place. Are the printers pretty much going 24/7?
Yeah. So I start them in the morning, and then I basically get up in the morning and then takes the prints off, start new prints, do any maintenance that has to be done every day, or replace the spool of filament, and then pull them off, pull them apart, I guess, the pieces, and then assemble them, box them up, and then send them off to the hospital.
Jared, tell me what the feedback you've gotten from the hospital when you initially even reached out and told them this was an opportunity that you'd be able to provide to them.
It's been very positive. It's always nice going in there and seeing the nurses at the front desk, their faces when they smile and they see the face masks coming in, and then even from the community too. Like, I've had people from the community reach out offering their assistance, offering their printers, offering their time to help me out, which is awesome.
This is, for a lot of people, this is a new technology. This is something that people are not necessarily familiar with. What sort of I'll say learning curve, or you talked about other printers around. Is this something you find there are a few of these around the community?
I didn't realize there were so many in the community up until now, but it's very much a hobby thing. I guess you can just play around with. Like you can make anything you want really. But yeah, I didn't realize until now that there were so many in the community that were printing.
You talked about the materials. Is it a material, even the material for the band as you showed us, is that a material that's difficult to obtain either normally or right now?
Right now, I'm using PLA plastic for the band, and it's been, I guess, harder to secure than I would initially thought. I was going to order from Amazon originally, but that was going to take too long. So I tried ordering from, I think, 3 different suppliers, and they were all sold out of the plastics that I wanted to use. So it's been a challenge, definitely securing stuff.
Yeah, have you found, you talked about partnering with some local companies as well that have helped out. Has that helped at least sort of open up some doors a little bit because of their supply chains as well?
That's helped. It's helped out a lot, especially with the laser cutter from All Seasons Trophies. I'm in exams right now, actually, so it's just been a little bit less stress on me to know that somebody's taking care of cutting the shields out for me. And especially with Manly's Basics as well, that they gave me the laminate sheets I needed before selling to businesses.
Sounds like a lot of people coming together. What do you know for this? Of course, Radiant 3D printing. What sort of things were you making in the past, and obviously now being agile and moving into this? But before this, what sort of things were you involved in making?
Oh, I've made a lot of things. I started out. I think my first project was making a baseboard heater end cap that somebody had broken, and I've done everything from that to laser tag parts. I made some custom pieces for the virtual reality place here in town. I've worked. I made cookie cutters. It's hard to say like everything, but I've done. There's no one category that I work in. It's kind of a variety of things.
Are you keeping your eyes open if there's any other types of pieces of equipment that could be of need, or have you found that the masks and the evolution, I'll say, of the masks, as you said, with testing them out, and of course the back straps, has that sort of been maybe the area you're going to focus on at least until the pandemic's done?
I think right now my bottleneck is the printers, actually. I have managed to secure all my supplies, I think, for right now that I need. But definitely, if I had more printers or bigger printing capabilities, I could print more off a day. So right now I can do 40 a day. I leave my printers to rest for 1 day of the week just so they have time to shut down, and cool off. So I can devote 200 a week without stressing the machines too much. But if I was able to get more printers, I would be able to produce more of these for the community and do a wider variety of healthcare, I guess, sectors. So.
We were talking before we went in, you mentioned it as well, that you've got a printer coming in today. I think you're just going to pick it up shortly there. These things are not, this isn't your printer that, I'd go pick up at the business store and throw it in my backseat of my car. There's a little more to these.
Yes, they're definitely a little more advanced than the 2D printers that you have at your house. The ones that the one I got today is it's called an IDEX printer. So it has 2 extruder assemblies on the printer to essentially work like 2 printers. If that means anything at all. And it weighs about 110 pounds and is made of all metal.
Sounds like it's quite the interesting stuff. Well, Jared, certainly some great work done by you and the people that partner with you as well. And keep up the great work. And on behalf of everyone in the community, certainly a thank you. And certainly it's great that you're doing this for the healthcare workers, and all the best moving forward.
All right, thank you so much.
There's Jared Waller, Radiant 3D Printing, creating healthcare materials, those masks that you see that the healthcare workers need as part of personal protective equipment, creating them on 3D printers. Back with more in a moment on Sarnia Lambton Daily on your TV. Recapping our top story tonight, Blue Water Health is reporting an 11th death due to COVID-19. The total number of positive cases in the region has increased by 1 to 119, while 21 people are considered recovered from the virus, 1 more than Monday. That's going to do it for Sarnia Lambton Daily for this Tuesday. We're back with you tomorrow, but for now, for all of us here at Your TV, I'm Terry Doyle. Have a good evening.